and welcome to News 9 Facebook Live with me, Adarsh Vepachedu. One thing is certain. The entire world is waiting with bated breath for a vaccine, and we are beginning to feel that it is not too far. But where one challenge of developing a safe and efficient vaccine ends, the bigger challenge of distribution of vaccine and inoculating a country with the size of population we have begins. Now, there was a big assurance in this regard from the Prime Minister. Vaccine for every single person in the country. Now, that's a lot of vaccines. And for the same, the Prime Minister said that over 28,000 cold chain points as well as a digital platform to enroll, track and reach out to beneficiaries will be made available. Now, there will also be dedicated teams at state, district and local levels that will see to it that the vaccine distribution and administration are done in a systematic and accountable manner. While the logistics are being worked out, Prime Minister Modi's assurance of vaccine for all has raised hopes of it being free. And given the vaccine's huge impact on public health, it is reasonable to expect that the government makes it available free for all. So how will all the nitty-gritties work out? Do we have enough infrastructure in place? How big of an exercise will it be to inoculate an entire country the size of India? To try and understand some of these very important factors, we have with us Dr. Satyajit Rath, who is a former faculty at National Institute of Immunology, Delhi, joining us on the program. Many thanks, sir, for speaking to us. Now, Prime Minister Modi assures vaccine for all Indians. You also have the BJP speaking about free vaccines in their manifesto. Wouldn't free vaccine for all be on expected lines, and shouldn't it be the government's prerogative?
Well, let me say something about the step that you came to before you talked about implementation,
All right.
which is we are all talking as though there is going to be one vaccine. And the logistics of implementing one vaccine across the country, free or otherwise, are monumental enough. But the more messy reality is likely to be that there is going to be more than one vaccine. Right? These vaccines will have different cold storage condition requirements. They will have different prices. They will have different supply chains and supply schedules. And they will have different numbers of doses at different time durations. Consider just how much messier, both in financial terms and in logistics and implementation terms, such a situation becomes.
Okay. Dr. Satyajit, you were just speaking about the financial aspect of it. The estimated cost for the Moderna vaccine is about 15 rupees per dose, and sourcing all necessary doses from Moderna would cost about 2,50,000 crore rupees. On the other hand, the Serum Institute of India has promised a certain quantity of the Oxford vaccine at about 3 rupees per dose. And if India were to buy all vaccines at this cost, we would have to roughly spend about 50,000 crore rupees. Now, both these costs include a distribution cost, which is assumed at roughly 20% of the vaccine price. Now, if you were to put all these variables together, the cost of vaccinating India is about 1,50,000 crore rupees. Now, it may sound like a big number, but it is doable in a sense. Isn't this one-time cost an essential investment with increasing returns going forward?
So, I once again have a tangential response to this, I'm afraid.
Please.
What is the evidence this is a one-time cost? In other words, calling it a one-time cost assumes that one vaccination shot protects you forever.
Right.
But this is likely not to be the case.
So you're saying there would be a booster dose?
A number of people within the vaccine development field have indicated that it's likely that a vaccine booster shot will be required for many of these vaccines in a year or two, which means that for all intents and purposes, as far as implementation is concerned, we are talking about a vaccination cost that is annual or at least biennial.
Okay.
How do the financial arithmetics work out then?
So it is indeed a big amount that we're talking about, but nonetheless, it is something that the government can go ahead and fulfill. What is your stand on what the government should ideally be doing in this particular case, and how should we be looking at this?
So my difficulty with this is that we are looking at this as though this is a single-time crisis management problem, but it is not. It is simply one more point, a straw, to use the old image, if you like, on a camel's back, as far as public health and its delivery to all Indians is concerned. So one of the difficulties with this is the Prime Minister has indicated, Dr. Kipao, who chairs the particular expert group for implementation, has commented that there are 28,000 cold storage
Correct.
points. The question is, what is the technical condition of these points? What is
Correct.
the capacity of these points?
Correct.
Again and again, the point is made that there will be teams made available for this vaccination. Are these teams available for the long term? In other words, are they regular public employees who will be doing the vaccination part and parcel of an extended, expanded, systematic public health outreach program? It's only when we commit to the larger context of public health that we begin to have an appropriate context in which to fit the COVID-19 vaccination program. We should be treating the COVID-19 vaccination opportunity as a way of putting right our public sector, public government priorities in providing systematic, preventive, as well as curative public health to all Indians, regardless of income capacity.
True. Now,
And for that, we need a really systematic, long-term answer to the implementation rather than a crisis management response.
Okay. Long term is certainly one aspect that we should be working towards. But again, looking at the short term, what would be needed on ground to ensure that the vaccine reaches the common man, every single person? We're talking about 28,000 odd cold chain points. Have we seen a vaccination drive of this magnitude before? And how prepared are we? You raised a pertinent question about how able and how worthy are these 28,000 cold storage points. Apart from the cold storage points itself, what are the other roadblocks that we are likely to encounter in the process?
So, in addition to the cold storage points, and keep in mind that these cold storage points will, for example, sustain the kind of cold storage requirements that the Moderna vaccine or similar RNA-based vaccines have, which is very far below freezing temperature requirement. But that aside, in addition to the cold storage, keep in mind that our current vaccination in the public health sphere in India has been either the annual childhood vaccination injections, which are spread over the year uniformly. Pretty much we know what numbers to expect, and those are relatively small numbers because they are based on how many children are born each year. The only additional larger vaccination we have undertaken in terms of scale is oral polio, pulse polio vaccination program. That's oral, and therefore it does not involve the syringes, the needles, the higher levels of skill training of the delivery people, the monitoring for adverse effects such as injection infections, and so on and so forth. So in both scales, we are likely to need, at a very, very, very rough hand-wavy guess, about a tenfold enhancement in quantitative scale of our capacity. How is this to be achieved, and how is it to be sustained if such a vaccination is to be provided annually as a booster dose? Becomes again and again the worrisome question that all of us should be asking the government to clarify.
True. Dr. Satyajit, we're talking about inoculating 1.4 billion people across the country. What are some of the challenges that we may face looking forward, because we are looking at ensuring that every single citizen of the country gets that vaccine? And I'd also like you to brief about the timeline as to how many months might it take before we ensure that every single citizen of this country is inoculated at least the first time. So how many months or years could it literally take?
So let's keep in mind that in addition to our on-ground limitations of capacity that we just talked about. The larger sort of upstream problem, if you like, is what is the time schedule of supply of vaccine dose numbers from various suppliers, and how likely are they to stick to those timelines? Number one. Number two, has anybody talked to the syringe, needle, swab suppliers to ensure that adequate numbers of these things, which are actually going to be used to inject vaccines into people, are being provided, and what is the time schedule for providing those? And since we are talking about quantitatively upgrading our capacity, meaning delivering vaccines at 5-10-fold the numbers, we are inevitably going to need far more personnel if we are going to do this in any reasonable time than we have available at the moment. They are going to need to skill training. What are the programs and what are their schedules for providing people with the skills and the training required? Because of all of this, it's extremely unlikely that anybody other than what the categories that the government decides are immediately at-risk people. And those, I think correctly, are likely to mean the public servants who are most in contact with cases, which is what the American phrase for them is first responders. What that really means is everybody who works in health, and that, let's be clear, does not include simply physicians, but also nurses, paramedics, nursing aides, ambulance drivers, and so on and so forth, as well as police and other public servants who interface with the public at large. Those are the ones that over the next year, all things going well, meaning that the current vaccine candidates throw up approvable vaccines, which is by no means a sure shot thing.
Truly.
But if that happens, all things going well, over the course of the next year, I envisage that those are the people who are going to get vaccines.
Okay.
I don't think that wider vaccine outreach is going to be practicable, to your phrase, for all Indians any time in the next few months.
Okay. So it is going to be quite a long exercise, a mammoth exercise at that. Many thanks, Dr. Satyajit, for joining us and for sharing with us your insights on how this entire COVID-19 vaccine drive will really pan out across the country. Quite a few challenges and quite a few logistics that the Indian government and the Health Ministry will still have to work out at this point in time. And we shall continue to get you the latest on how efforts on that front will pan out in the near future. With that, it's a wrap on this brief live interaction. If you've liked the information that we've shared with you, do not forget to like, share and subscribe to News 9 on YouTube, Facebook, Instagram and Twitter. Many thanks for joining us.